I have had the privilege to focus my research and my practice, well, mostly my research on Torticollis, and I actually started with infants and children who kind of developed the Torticollis, the kind that they would, develop in the womb. And then through that, and doing my research, I sort of became the Torticollis person at our clinic, I guess maybe the Torticollis expert. And so because of that, I started then also seeing all kinds of different, Torticollis, including, of course, adults. And that's where I gained my experience working with spasmodic torticollis or cervical dystonia. And as you all know, it is not really common. So anyone who has any experience at all is relatively valuable. I haven't had, I would not say gobs of experience, but I have enough that I feel like I can at least synthesize what physical therapy can do for cervical dystonia, and then hopefully answer some of your questions and maybe help to guide you on your journey as well. So, yeah, okay. And then also, I had some goals, but it looks like some of these wonderful physicians have kind of covered a few of these things, and one of them I think I just am going to throw away. So anyways, I would like you to be able to come away from this with being able to identify some physical therapy interventions that are beneficial and that have been shown in the research to help your cervical dystonia or spasmodic torticollis. I did want to kind of talk about the positive negatives about some research stuff, but I think we're actually going to do away with that. So I definitely want all of you to feel like you are able to come away from this with more tools in your tool belt to be able to advocate for yourselves or your loved ones who have this disorder, and that you can go and speak to, and talk to your providers to be able to advocate for yourself. So that is my biggest goal. Now, in regards to physical therapy, now I want to hear from you. First of all, who has seen a physical therapist for your cervical dystonia or spasmodic torticollis? Show of hands. Okay. And then who has not tried physical therapy yet? Okay, a smaller number, but okay. So a few more than not have actually tried physical therapy. And tell me about, second question, have any of you had a course of physical therapy that was basically timed in conjunction with a Botox injection? Or any injection, to be honest, for treatment of your symptoms. Has anyone had that where it was sort of like a paired, we're going to do physical therapy and injections at the same time and see one person? Okay, most people, 2, 3? Okay, maybe, okay, fair enough. All right, and then, okay, opinions. We'll just do maybe thumbs up, thumbs down. For those of you who have tried physical therapy, overall, for your symptoms, for yourself, your experience, was it positive or negative? Okay, I see, yeah. Thank you for being honest, that's fine. Negative. Okay, actually that almost looks 50-50 to me.
Well, neither. I mean, you got to, because I have it, I haven't.
Oh, okay. So like some was positive and some has been negative?
Yeah.
Okay, fair enough, yeah. All right, and then I would say that this was relatively, I would say almost half and half. There's been some positive, there's been some negative experiences. Okay, thank you. That helps me to know sort of what the tone of the room is in regards to what we have to offer. So for those of you who haven't yet been able to experience going to a physical therapist can identify, diagnose, and treat movement problems in people of all ages and different abilities. Specifically, what do? We're movement experts. We're not the neurologist movement expert, but we are a physical movement expert. We try to improve your quality of life through hands-on patient care, education, and prescribed movement or prescribed exercise. Our goals are always to improve your life, to decrease your pain, improve your function, your ability to do things that you need to do in your lives, and to hopefully improve some of your quality of life as well. Okay? So that's our goals. And then we have cervical dystonia. And so what can we do with that? Well, I don't really even need to go over this. You guys know what this is, so we'll move on. There's so many different types, as we are learning, of interventions, treatments, different things that can be done both medically and what you can do on your own. Obviously, I'm going to speak about the physical therapy interventions. This is a former patient of mine, and his was an interesting story. I was kind of talking about him to my table when we were eating lunch. Most of my patients are usually diagnosed by the time they get to me with this kind of thing, but he was interesting because he did not actually have a diagnosis yet. And I know some of you said that it took you a couple years, even sometimes up to 5 or possibly more years to receive your diagnosis, right? And that can be an incredibly frustrating time, I'm sure. He was kind of in that boat. He came to me, I think they just said neck stiffness or just neck pain of some sort, and that was all. And yet he came, and this was his neck position. And he did give me permission for this, to show his pictures. And I have some videos as well. And I'm sure some of this will be very familiar to some of you. We just took some videos of his motion. As you can see, he is very limited on his left side of his neck, yes? And and you can, I don't know if you could see that it almost was like spasming. You could sort of see in his neck a little bit of like a twitch as he was trying to turn his head away from his tighter side on his left. He was turning to the right. So I know that seems pretty familiar to you, but anyways, I'll get back to him. Oh, I'm sorry, I forgot. There was one more video. So this is him just looking up. I hope this one works. Sorry, I had to make a really big box, but anyways. And you can just see the limitation as well as how his nose deviates to the side where his tightness is, okay? So not unknown to you. I'm going to go faster through this part because I think it might actually not be as beneficial as I thought. So I was going to take a look and have you go through 2 particular studies that I thought was going to be good information, and we'll just briefly touch on it. The first one is a systematic review that was done in 2022 about physical therapy for cervical dystonia. And it's systematic reviews are different than meta-analysis, and I'll talk about the difference for a second. The second one is this one that was just published in 2024 about the effectiveness of physical therapy for patients with cervical dystonia. I think this probably isn't super interesting. Is this interesting, or do you not really care about what? Go talk about it. I'll just say it real brief. Okay. Just really briefly, a systematic review, if you ever want to dive into the research yourself, is a pretty top tier kind of thing in this triangle of like all the evidence and the literature that's out there. It's really helpful to synthesize a whole bunch of information about one particular question, a research question or a disorder or something like that. So if you want to kind of have a shortcut to get to some answers about say cervical dystonia, then if you can find a systematic review, it's super helpful because it really gathers the most important and pertinent information. But it really just is more like gathering that and putting it all in one place, okay? A meta-analysis, however, is a research paper that they also collect all the most pertinent research studies about one particular question, like physical therapy and cervical dystonia, or something along those lines. But then they can further, if the studies are similar enough, and they can analyze, statistically how similar or dissimilar or biased or unbiased they are. If they can find studies that are relatively close enough, and maybe this study had only 15 participants, and this study had 20 participants, or maybe 30 participants, and they examined a relatively similar question, a meta-analysis can be done where they basically get to group all of those patients together, even though they're a part of 2 totally different studies at 2 totally different times. It's almost like you can take the results and put it all together, and you can actually look at it and statistically analyze it and see almost like a bigger group effect, and that can tell us more information about if we were to add all of those patients together, or in the people in the studies, then is it still even effective with everyone or not, and how strong was that effect? So it can almost give us more information by being able to do a meta-analysis. So this one is like the top tier. It's like one of the best things that we have out there in research, and it tells us a lot of really good information. Okay, done with that. So physical therapy, the systematic review, I'm just going to briefly talk about it. It just reviewed studies that examine the effectiveness of physical therapy in conjunction with Botox injections. And we've talked a lot about that. So previously there was I'm going to move past that because that's not important. This particular systematic review included 6 randomized controlled trials, 3 studies compared Botox alone compared to Botox plus PT. 1 study did a botulinum toxin plus relaxation compared to botulinum toxin plus PT. And then 1 study did Botox with regular PT compared to specialized PT with Botox. And 1 study talked about Botox plus PT compared to PT alone, so no Botox, okay? And subjects improved in all of them, basically. But especially when PT was combined with the Botox injection. And perhaps, I'm hoping that that might be new information for some of you. It was very highly variable what the different types of PT and what they did in those PT sessions as a part of each of the research studies. Sometimes it was massage, stretching, postural, re-education, reteaching your posture, muscle strengthening, we've talked about this, biofeedback, isometric and active exercises, kinesiotaping. They included a lot of different things in the different studies. Some of them had standardized PT versus a specialized PT program, home program versus supervised PT program, 30 minutes up to 90 minutes. It was just sort of all over the place, and sometimes 8 sessions all the way up to 40 plus sessions. So that's just the differences in all of these studies. But there were significant improvements for PT plus Botox when you combine them together. There was not necessarily, there wasn't a clear difference between the different combinations of all the different PT stuff. So specific versus regular, specialized versus standard neck PT, both basically improved in their function. 6 weeks of exercise versus like home program, everybody improved, but there wasn't a specific like, oh, these people dramatically improved because of this one PT protocol that they did in this one study. So kinesiotape, there's just like, there was a lot of different ways that they were able to achieve those improvements, and it was all in physical therapy, but it wasn't like one more than another, or one group more than the other group. It was, they all improved in their function. Okay, second study, the 2024 systematic review and meta-analysis, bing, 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 that should always, say this is a really important study that we should take a look at. So it examined the effect of PT on patients' functioning, pain, disease severity, and quality of life, and evaluated the effect of PT as an add-on to Botox with a meta-analysis. So they included 14 studies. 12 out of the 14 used lots of various physical therapy modalities. 2 studies just only used taping, and I'll talk about that in a second. 11 out of 14 examined physical therapy added to Botox. And then the effects of physical therapy on pain. They investigated like how much their pain changed or improved, hopefully it improved. In 14 studies, they used either the VAS pain scale, do you know what that is? Where you just, it's the visual analog scale, where's your pain, is it 0 to 10? That's the pain scale, or the Twisters pain subscale. Has anyone ever been given a Twisters questionnaire? It's okay if you have never, okay. It's just a way that you can rate how your symptoms are doing, and we can use that to kind of measure any changes in research. So all studies reported 30 to 50% reduction of pain in the PT group compared to the control group. So for me, that's the part I circle and highlight and underline. That's a pretty big number, I would say, that 30 to 50% experienced a reduction in their pain. When the two types of PT were compared, no differences were found between the two groups. Both groups reduced pain. So that's a really important finding. It also had a great effect on disease severity, so the severity of your symptoms. They investigated that using the same Twister scale. Once they found improvement in the dystonic postures after performing motor training with physical therapy. And then other studies showed improvement in the disease severity scores. So this is a self-score of how you would, rate how is your disease affecting your life. So their scores improved in the PT group. Okay, disability. How is this lessening your disability or maintaining? So there were significant improvements reported in activities of daily living. Those are ADLs. So like, washing your dishes and getting out of bed and washing your hair, taking a shower, taking a bath, brushing your teeth, those are your ADLs, okay? Significant improvements were reported in ADLs in the Botox plus PT group versus Botox alone. When compared to the two types of PT, again, both reduced disability, not one more than another, but they both helped. Okay, quality of life, basically, there was some improvement reported in quality of life. One study found no effect, but the other ones did show some improvements, okay? So, essentially, I was talking about there was two studies were able to be combined. How I said with a meta-analysis, they're able to sometimes combine similar enough studies to make like a larger pool of information and then be able to draw like more conclusive results, I guess you could say, from that. So they were able to pull two different studies that were similar enough, and when they pulled the data, PT plus Botox showed a significant positive effect on pain reported by the Twister scale. So that's something that we do get excited about, especially when it can be significant enough for everyone. And as I come to understand, pain is a big part of some of the symptoms here. So this is kind of our summary. PT can have a beneficial effect on pain, disability, disease severity, and possibly on quality of life, which could be hopefully helpful for all of you. So again, they just investigated a lot of different types of PT. Has anyone experienced what kinesiotaping is? Okay, a couple. For those of you who have never heard of it or seen it, sorry, this is a little bit hard to understand what that is, but this is a lady, she's kind of turning her ear, and then there's some tape on the side of her neck over here. And then this one's in color. There's just some different ways that you can tape. It's supposed to just, well, it can actually do a couple of different things. It can help to decrease the sensory activity on certain muscles, and so you tape along the muscle that you're trying to. It can also do the opposite. It can increase the sensory input to the opposite muscle, and therefore hopefully decreasing the sensory input to the affected muscle. On this one, I think they're trying a couple different taping techniques. Basically, it can distract the brain because you can feel the tape gently on your skin. It's not necessarily pulling anything tight. It's not stopping any motion. It's not strong enough. You don't put it on so tight that like I can't move now in a certain direction. It's not that kind of taping. That's more like athletic taping. This is more just of a different sensation that you can feel on your skin when the tape is on you that essentially, in a good way, can kind of distract your brain into going, oh, there's something new here. And so my brain is like in the background sort of thinking about this tape that's on my neck in various different places. And that can also help to decrease your pain sensations because the brain's like, wait a minute, this is new. I'm going to pay attention to this because I'm used to my pain, but I feel something new here. So I'm going to be thinking about this. What is this new thing? The brain craves new and novel, and so it's thinking about the tape and not thinking so much about the pain. And that can also then decrease the overall tension and the overall stiffness symptoms in your cervical dystonic muscles. Does that make sense? So it's a little bit of a a PT brain trick, but this is one of the ways that it can help. Now there's some other things it can do as well, but primarily that's what it would be used for in a cervical dystonia type of situation. Okay, so this is where I'm gonna sort of just go off of the, the plan here, because I do feel like the physicians that we had this morning did a wonderful job talking about and supporting the role of physical therapy. I hope now that you can see just briefly that there's a lot of evidence that shows that physical therapy can essentially like boost your results if you're able to receive it at the same time as your injections. Now, one thing that I would really like to find out is if anyone's had, well, I kind of already asked that question, but since the DAX is new, and they were telling me about how much longer it could potentially last as far as like how the effects of it. Like I think he was saying 20 to 24 weeks potentially. That sounds even better. And why not? Like, and so I'm wondering if new research will hopefully come out that could compare, you know, what could happen in physical therapy if we were to pair DAX injection with physical therapy and not Botox. Could we get an even bigger effect? I think so. So that's, you know, another research question that I'm even coming up with as we're here and as I'm hearing all these experts talk. I just want you to be able to have the tools and be armed with the information that you need in order to go perhaps back to your physician or your physician that is already or could be in the future administering any injections should you choose to go down the injection route, and have some tools and say, you know, I've not read the research myself, but I had it summarized to me from a physical therapist that this could be actually even more beneficial than just Botox alone. That if I were to time my physical therapy referral and my therapy with my Botox injection, I could get even more pain reduction and better function and better quality of life. So can we try it like that? Can we, you know, time the referral and the injection so that I can actually receive my physical therapy right when that medication, when that Botox is in my system, and now it's really working to, you know, relax or paralyze this really, you know, dystonic muscle or group of muscles. And then in that meantime, we can stretch it, we can increase range of motion because it's not just grabbing so tight. Maybe I can actually gain some strength in the other muscles that are just struggling against this way overpowered muscle, right? Or I keep saying one muscle, it's a group of muscles, but really like one muscle is, or this group is just like taking over everything, right? And it's just so overactive. And what we don't talk about is what's happening with everything else. All of these other muscles that are supposed to support our head and our neck and our posture, our upper back, these ones are having to still keep us upright, so we're not just falling over. Although sometimes the neck is really, or the head is almost falling over because it's so tight and it's pulling so hard, right? This is pulling so hard. These are having to, are working so hard, but they are losing the battle essentially of fighting against this really dystonic side of the neck, right? And in the meantime, they're getting weaker and weaker and more imbalanced, okay? If we can then use whatever methods that the physicians can use to weaken this overactive muscle, and in that meantime, strengthen up all of those other counterbalancing postural muscles, then when things start to wear off, perhaps we can then leave your neck and your body in a slightly better position. It's stronger, it's finally able to overcome some of this overactiveness and then be able to end, in the end, you know, have a stronger base to start with, or to continue on with, I guess I should say, so that then you can correct that really, really dystonic posture a little more easily, because these have been able to actually gain strength because they haven't been being so bullied by this one, if that makes sense. So that's one of the biggest things that I think physical therapy can accomplish during that window of time that you're receiving the benefits. That's sort of like a peak of that Botox and how effective it's being. And then like after a certain number of, like 8 weeks or so, I don't know, those of you who've had it, you might have different opinions about when you feel like it was really peaking and when it really started to kind of taper off, yes? So I think that physical therapy can really be so much more effective during that peak time, and so it can really help you a lot more than just with PT alone or with Botox alone. So that's kind of my main plug. I also, I do want to address, if I have time.
Yeah, you got time.
Okay, lots of time, good. Because, yeah, quite a bit of what I was going to say, I mean, it's already been supported by our other speakers about how important exercise and all the benefits exercise can give. Now, I mean, I would say yes and even more, basically, about the exercise thing. Exercise can do so much more as well in regards to, yes, you get all of the endorphins, and that helps to modulate and improve so many of your functions. It's kind of, it is the opposite of the stress. Everybody says that stress can really worsen your symptoms, right? Then exercise should and would likely, if you can find the right one that seems to give you the most benefits, exercise should do the opposite. It should help to relax your system. And I think hopefully everyone can testify that if your system and your whole body is, the more relaxed it is, the less your symptoms are happening. Is that true? I mean, you guys tell me. I'm not the one that actually has this. Please tell me, like, am I wrong?
Yes.
Oh, we're right? Okay, the more relaxed you are, so what else can we do to find those things that can give you that sense of relaxation, can quiet your nervous system? Well, I think that's why some of those sensory things really significantly help. And we're not touching on it today, but I know that in the past, I think that there's been some physical therapists that have talked about aquatic therapy. Is that right? For any of you who have been here before, aquatic therapy is basically like physical therapy in a pool. I don't know all of the ins and outs of it, but I know that anyone who gets in a pool just feels better. It's so relaxing to our sensory system. We feel the water, hopefully it's a nice temperature when you get in, and then just that extra buoyancy, you feel lighter. You can just kind of like glide. It's such a wonderful sensory experience, isn't it? And especially if it's a nice, really warm water, even better, right? That's super relaxing for our bodies and just for our whole nervous system. That, I think, alone could be one of the main benefits from aquatic physical therapy. It's just the sensory component. If there's, I think one of the physicians was talking about, I forget who, was talking about that scarf thing, about the sensory trick. Is it just that they can feel the scarf around them, and is it just the brain is thinking, oh, I have the scarf on, I can feel it, and so it's distracted? Or is it because that's a pleasant sensory experience for them? Maybe that's it. Maybe this is just like a soft, comforting kind of thing, and that just calms that nervous system. Your physical therapist and even your occupational therapist are experts at helping you try to find those relaxing sensory inputs that can be extra little tools that you can find to calm that nervous system down. Exercise is one of them. I cannot tell you how many times I have a patient who comes in with a headache or with certain other kinds of problems or pain. They're tense, they're tight, they can barely move or whatever it is. And I do what I can, and it only can help so much. And then I just get them on a treadmill, an elliptical, a bicycle, and we just talk and we just sweat it out. And they move better after just that little sweating session because you warm your body up from the inside out. And there is no heating pad that works as good as your own internal body core temperature rising from just getting a good heavy breathing exercise on some sort of something, okay? It will relax your muscles in ways that my hands and any other modality just cannot do just as well as your own body can do, okay? When you exercise, when you get those all of the psychological effects and all of the positive endorphins, those are natural painkillers. And it is no secret, I can attest to it to myself. How many times have I gone to the gym? I have had a horrible day. I have a raging headache. And as soon as I'm done with my workout, my headache is nearly gone or almost completely gone. All the circulation improves, you get those endorphins, those are your natural painkillers, and you don't have to pay any money, well, maybe not, but you might have to pay a little bit if you go to a gym, but you can still go out and get a walk, you can get some exercise, you can go, huffing and puffing down the street, and it doesn't have to cost you anything. And of course, there's no side effects of natural painkillers in your body, right? So, but what can you do if you're like, I've tried physical therapy, and I certainly did not get those benefits. I'm just going to quickly show you. This was him. This was the video I showed you just a little bit ago. Stiff, tight, kind of, you can see the neck kind of spasming. Uh-oh. It crashed. All right. It's all right. I only have 2 more videos, and hopefully they won't crash. Sorry. I was worried that was going to happen. Okay. I have some after videos. It wasn't even after, it was sort of midway through his therapy, but he had had a number of sessions. And I was just hoping to show you a little bit of just one patient. This is not every patient, but I just wanted to show you what this one patient, how he could just move a little bit different. And of course there was other things that we were checking on and working on, but just that simple one neck motion, I just wanted to see if we could see a little before and after. Yeah, go ahead.
While we're waiting,
yeah.
Can you maybe speak to a little bit more specifics on what kind of physical therapy you're talking about?
I know. Yes and no. So this was also a part of kind of this discussion we were having around my table at lunch. I want to, and yes, I feel like I should, but this is one of the problems. There are so many, and I'm sure that some of you could say, yeah, and you're nodding as I say this. There are so many different physical therapists, and they use so many different approaches. They use so many different modalities, and they're all trained, different schools. We would love to say that if you see a physical therapist, you're getting this standard of care. I will be honest with you, that is not true. There are so many physical therapists that have no idea what cervical dystonia is. Has any of you had that? You go to your physical therapist and they're, okay, very good, thank you. All right, I will admit, it wasn't about cervical dystonia, but I've had at least 2 patients come to me and they had some other disorder. And I said, I'm so sorry, I don't know what that is. And they said, it's okay. I understand, I have to educate most of my providers about this because they don't know because it's such a rare disorder. And I had to work hard I had to look up research. I even was able to, on one of my patients that had this other disorder, not cervical dystonia, contact a researcher, and she gave me tons of information. And then I felt like, oh, okay, now I know what I can try here in the clinic. But I realized that it's so tough for you. You're the patient. You shouldn't have to educate your physical therapist. And yet that's the reality, is that sometimes this is such a rare disorder. It's not impossible to come across it, but it's rare enough that the average physical therapist out there probably won't remember that they actually did learn about it in PT school. They just will forget about it because we just hardly ever see it. Or they won't know what to do with it, even if they could vaguely remember what it was, right? I am just being transparent here. This is my field, and I care about it, but that is the reality. So what can we do, right? I think educate your physical therapist. I'm going to back up. First step, either look up if there's any neurologic clinical specialist therapists in your area, and I'm going to show you how to do that in just a moment. And see if there are some NCSs. NCS is Neurologic Clinical Specialist, and that's a term that we've done a board certification in neurologic conditions. And we've taken a big fancy test, and we have this specialty. So those are specialists. Those should have a better idea, okay, than just your average, PT in a PT shop down the street, okay? So looking for some of those specialists and seeking them out, or just, if you're in a small town, you're like, there's really only 5 physical therapy clinics or locations in even my larger area. Call them up and say, hey, I'm shopping for a PT. Does anyone have any experience either with neurological disorders, any expertise? Does anyone at your clinic have an NCS? That's the Neurologic Clinical Specialist. Narrow down that search that way. And if they don't, okay, thanks. All you have to do is call about that. You know, you don't even have to walk in the door, or you could walk in the door if you want and ask around. What services do you provide? What's your strengths? I think any PT that is worth their salt should be able to be honest with you and say, I would love to treat you, but I have no expertise in this area. Here's an expert that I know of that's in the next town. I know they have an NCS, and I believe that they've seen something similar to this, if not that exact same. Here's their name, okay? Hopefully they will be frank and honest with you. I know that's not always true. I'm sorry about that. But you have the right to shop around, okay? And that's where I want you to know you have the right, and please do shop around. I think that if we could educate our patients to know that there are certain subdisciplines and certain specialties that should be able to handle your cluster of symptoms better than just average Joe PT, then please seek those people out, okay? If you cannot find any of those in your area, even if you look up and you ask around and things like that, then I would say look at some of those resources that we just saw about virtual PT and physical therapists who are experts, but they have online exercise programs. That's probably our second best option. But my first best is go to see a specialist, because this is such a specialized and unique disorder. Going to your average Joe PT is not probably going to give you that great of an outcome, unless they're just like a cut above and they're like, hey, I don't know anything about this, but I am willing to learn. I'm willing to put in the extra time. I will read all the research. I will look up all the stuff, that I can find and do whatever I can that's gonna help you. Now that's someone, even if they didn't have NCS after their name, I would still go to them because they're willing to learn. They're willing to learn with you and figure out exactly what you individually need and what the research has said that is out there that's beneficial. And so I think that person would be a trustworthy person to say, okay, let's learn together what works for my body. Yes?
I had one who did that.
Oh, you did?
Every time I came back, she had learned something new.
Oh.
She'd actually contacted another PT place that do it very well.
Oh.
And got the information from them. I think she even probably started taking classes or something from them. But every single time I went back, she learned something new, and she was amazing.
Thank you. Did you all hear that?
Yeah.
Okay, there's hope. There is hope that there are some PTs out there like that. Yes?
I have a question.
Yeah.
You talked about pairing PT with Botox.
Yeah.
You kind of implied, but you weren't really clear what you're talking
Oh,
about.
okay.
So are you talking about PT needs to be done on the day you get the Botox?
Oh, no. Actually, what?
That's what I wanted to know.
Yeah, that's a good question.
I didn't know when in this pairing you're talking
Yeah, you're right. Okay, so let me say that a little more specifically. It really, well, and this is where I'm going to actually fall back on the patients that I have actually been able to do this with Dr. Dashapur and in our clinic. And keep in mind, we do this with cervical dystonia. We can also do this with other types of spasticity and dystonia. So what we typically do is we'll actually have the doctor send us a referral, and we will do an evaluation of the patient. So we get the authorization from your insurance to see you for your evaluation. The physical therapist takes down all your information, and this is where you're at with your life and your pain and your neck and everything. And they do their evaluation. And then the doctor, hopefully the patient comes to me and says, I'm scheduled for my Botox injection on this date. And I say, okay. And then we look at the calendar and I say, all right, so about at least 5 days after your injection, roughly, we want to start PT treatment number 1. Not the evaluation, but PT treatment number 1, okay? And then this is where it's a little bit variable depending on just what your life can do and what they can do, and as far as how often they can get you in. I usually recommend at least 1 time a week for 12 weeks, because most of the injections say they should last for about 3 months. And so and most insurances will at minimum authorize at least 12 visits in physical therapy. There's a few that don't, but almost all of them will at least give you 12, okay? So, but then that includes the evaluation, so let's say 11. So you do your evaluation, you time your first treatment to be just about a week after, or sometimes even 2 weeks after your first injection, okay? Or your injection. And then you just see your physical therapist weekly during that next 11 weeks, Okay, does that help spell it out a little more?
Yeah, and it sounds good to me in another way too, because I wouldn't want you to only see me after I had Botox
Right.
and I was doing better.
Yeah.
I want you to see me sometimes when I'm not doing so.
Exactly.
So that actually is a good plan.
Yeah, because we need to see you before the actual injection. This is when you're kind of technically at your
Well,
worst.
My doctor's like several others that say
Yeah.
don't do massage or anything like that
Oh, okay.
for a couple days after the
Yeah,
injection.
yeah. And I mean, yeah, so I think that's fine. If that's their preference, you know, they can communicate that to your physical therapist. And then, you know, we wouldn't necessarily be massaging per se. In fact, there's very few physical therapists that are just gonna do massage. We're really about exercise, healing the body and stuff like that. So our hands-on will not necessarily be a big part of the treatment, hopefully. The majority of it is going to be stretching what's tight, strengthening what's gotten weak, and then re-educating your body. Hey, this isn't your normal anymore. Guess what? We can, you know, try to reprogram the brain that this needs to be our normal now, and that this movement should be normal instead of, you know, those kinds of movements. So, yeah.
I've gone to, I've had dystonia for a long time, and I've gone to different neurologists and everything, and I've gotten the Botox
Okay.
injections, but none of them have ever mentioned anything about PT whatsoever. So I don't know whether they don't know anybody.
It's possible.
So I'm not scheduled to go back now for another 3 months.
Okay.
When I do, I'm going to ask the doctor whether he's aware of PT
Yeah.
being in association or conjunction
Yes.
with it, and find out whether that's a case. But I kind of tend to think that most of them, at least where I live, they don't
Yeah.
know of anybody that's qualified to do that.
It's very, very possible because then, like I said, the two studies where we're talking about big important studies, like yes, pay attention, this is really important information, 2022 and 2024. And most of your physicians, the time that they're looking through the research is when they were going through residency. How many years ago was that? I don't know. It could have been recent if you have a very young doctor. I don't know. But the average person, yes. I mean, maybe they haven't been in the most recent research as of the last, 4 years. So, or 3 years anyways. So it's absolutely possible they are not aware of the added benefit of pairing that PT with Botox alone. So that was the handout that I tried to put together for you. I don't know if anybody has that.
It was the first time I even heard of, doing PT in conjunction with it, just listening to you today.
Oh, okay, good.
Yeah.
Wonderful.
And a lot of the neurologists I go to are good, but they just
Yeah.
never mentioned anything.
Right.
I definitely will bring it up.
Okay, so and then hopefully you can take the handout that I provided, and this is something that you would just be like, here, you read this, please, because this hopefully will speak to that physician's mind when they see the actual research study. I just did like a screenshot because I want them to be able to see the summary, because I know they don't have a lot of time to read the entire article, but if they at least see the summary and see that a meta-analysis has been done, that they are going to really pay attention to that. That's really high quality research with lots of good evidence. And I'm hoping that you can just give this to them and say, hey, this next time I do my injection, I want to time it with PT just like that, where I can at least have my evaluation either on the day of my injection or a couple days before, or even if it's a couple days after, because we still kind of have that 2-week window where, like you're still kind of recovering from the soreness, and then it's really starting to ramp up around week 3, okay?
But like I said,
Yeah.
I have a feeling that they're going to say,
Well,
they don't know anybody.
yeah, it's true. But I mean, give it a try. And then what you might have to do is say, I've talked to a physical therapist, I've told them that I want to try this, and then educate the physical therapist and show them this meta-analysis, because then the physical therapist can start digging deep. If they're a good one, if they're the kind that we want to see, they will start digging deep on the very specifics of what modalities. What did they do in those studies that worked? And that's why I can't answer that, because maybe they're going to combine some things that they haven't tried before, but they are going to follow what some of the studies have proven that there was good benefits from. And then that's why it could look different in every clinic, but hopefully there's going to be some overarching themes of they're going to exercise you, they're going to stretch you, they're going to teach you how to stretch yourself, they're going to teach you how to exercise your whole body, not just your neck, and they're going to work on your balance, they're going to work on a lot of these things. Hopefully that's going to be at least encompassing most, if not all, treatments. Yeah.
I have a thought. I have lymphedema in both of my legs.
Okay.
And I do go to a physical therapist
Okay.
for that. And I know that their company works with people that have had surgeries and different other things. I'm scheduled to go see them in another week or two.
Okay.
I will ask and see if they know of any of their therapists, because there's quite a few in
Yes.
that company.
Good.
And there's a possibility that they might be familiar with something like that.
Absolutely, yes. And like I said, NCS, I would start there. Does anyone do any PTs in this clinic have an NCS? Okay, that's your neuroclinical specialist, yeah. Oh, I'm sorry, yeah.
I'm not going to ask a question, but I don't know if you do Zoom, but in the handout, we have
Yes.
physical therapists that do Zoom.
Yes,
And I've had positive feedback.
wonderful.
from NPT.
Yes,
I didn't think it was possible.
I know.
But patients love it.
I know, a lot of times people assume that because I'm not in the same room as my physical therapist and my physical therapist can't touch me, that they probably won't be able to help me, but it's absolutely not true. If we, again, are worth our salt, we can still do it over Zoom. Because our job is essentially to teach you how to exercise and teach you how to move and not move this way and move better this way. So really, if we're doing our job right, we should be able to do it over Zoom. So yes, if you don't have an NCS or some expert in your area, then try the Zoom thing. Try those resources that you guys highlighted. Thank you so much. Yeah.
I have a question about new trends that are coming up. One is like zero gravity, the other is
Whoa.
playing an instrument, and the other is boxing that they're doing now with Parkinson's patients.
Okay, I've heard the boxing.
Okay.
I haven't, zero gravity, and what was the second one?
Playing a musical instrument.
Playing a musical instrument. Okay. All right. I don't know like anything about those. I have heard of the boxing for Parkinson's, which is another like basal ganglia disorder. And so I'm not sure if I should, can extrapolate those results over to cervical dystonia, although there are just some similarities until someone were to actually do some sort of a trial on that. I could see why that could potentially be a very cool idea, and that there are enough similarities that I could see why some of those things could work. For me, the principle underlying that, and this is where I'm just speculating, but we were talking about dancing, and how dancing can't, because you're practicing, you're doing neuroplasticity, you're learning a new movement pattern, and it can get you out of your old movement pattern, which is your cervical dystonia. I think that boxing is the same principle. You're still learning a new movement pattern, okay? And in that same sense, I could see how that could decrease your cervical dystonia if you were to do, hopefully not actual contact boxing, but hopefully we're talking like maybe shadow boxing or something like that. But anyways, learning a new movement pattern, just similar as dancing, should be able for many patients, to get you to get out of those movement patterns and try new movement patterns, which could help decrease your symptoms. Absolutely, yes. Yeah.
Yes, do you do dry needling?
I don't. We are I practice in California, and in California we are not allowed to do dry needling. But my brother is a physical therapist, and he's in Texas, and he can dry needle. So I can't really speak to dry needling. I do think it really can help and be very beneficial, but I can't, I wish I could talk more about dry needling specifically for this, but because I'm not, California doesn't allow us to be dry needlers and use that as one of our treatment modalities. I can't really speak to that, but I will say my brother does amazing things with it in his practice, and he's even worked on me, and it's the craziest thing, but I truly think it can extremely help, very, very much. So you've experienced positive effects with the dry? Oh, okay. So your loved one, then yes. So look into dry needling as well. Sometimes some physical therapists can do it in certain states, and sometimes not. So it just depends, but it still can be a beneficial thing, yeah.
What's the difference between dry needling and acupuncture?
That you would have to ask a dry needler because I'm not an expert. There is a difference though. from what I understand, acupuncture is looking, I believe it's looking at, or it's trying to pinpoint and actually put the needle into certain meridians, yes. And then dry needling is actually specifically trying to find the motor point in the muscle, I believe. Okay, that could be wrong, but there is a difference, and a difference in how they approach it. So yes, it's still a different type of modality. So, okay, should we take a look at my friend here? Okay, this is after a handful of treatments. I don't exactly remember how many. So you can still see that there was like some wavering, but I'm hoping that you can see an increase in the overall motion compared to our first slide. Let me go back. Oh, whoops, there it is. Oh no, go back. Can you just hit play for me on the little thing on the bottom, just because I'm not sure if I'm not doing it right, but yeah, that push play down there. So this was the before. I know you can't see your cursor. Okay, so this is before. Super slow, super stiff. And I mean, this was years ago. I didn't even know all this cool stuff that I just learned here, just from being at this conference. And then, okay, I can start that one. So hopefully you can see, look how far his chin can move further. And I didn't use anything fancy. He did not have Botox. This was just from our treatments. And this one, we asked him to go fast. And I know you can see a little bit more of it like kind of grabbing, but overall his motion is so much larger just in his rotation. So anyways, so that's my friend there. So any other questions? Okay, I want you to write down, or if anyone even wants to look up on a device, if you have Wi-Fi here, choosept.com. Just choosept.com, and then search for neurologic clinical specialist, and then it's going to give you a search line, a keyword, and then a search your area, your location, and then it's going to give you a list of those therapists who have received their specialist certification. I feel like that's a good place to start when you're trying to find a specialist, okay, in physical therapy that hopefully knows at least some things about some neurologic disorders. And then maybe somebody who's even potentially remembered or looked up some things about cervical dystonia. Okay, like I said, call around, and start asking if any of these people are in your area, and do they take your insurance? Would they be willing to work with your physician and time your Botox and your physical therapy together? And hopefully they will be able to just even sit down and chat with you, or at least call you and say, yes, we have a physical therapist that has their NCS and that has some experience with dystonia or of any sort, and then maybe some cervical dystonia, or just they've at least had to talk about it and learn about it when they studied for their specialization exam, because we do learn about it there. So ask those questions, advocate. Talk to your physical therapist, even if they don't have an NCS. It doesn't mean that you don't have hope to see someone, because if you find that therapist that's, hey, I'm willing to learn, and you can give them this information, the research paper I sent you, they can start looking up more. You can learn about it together and learn what is going to work best for your body. So I hope that gives you some options. I hope it gives you some ideas of what you can do to find the right physical therapy for you so you can get that benefit. Okay?
All right,